Assalamualaikum to all friends, and so we will present about the workplace environment and ergonomics of occupational safety and health. The topic we choose is noise and hearing. I will introduce my group members. The first is DAYANG ANISA, second is NURUL ANIZAN, the third is NORIKA NADIA, and the last one is me, FARISHA AKMA. First of all, this is an example of a warning symbol for noise and hearing in the workplace.
Noise is unwanted sound that can cause impairments or damage to health. This article describes the problem of noise exposure and workplace and the risk to the health and safety of the workers. The main sector having noise problem are identified, including the music and entertainment sector. Noise is one of the common physical hazards present in the occupational setting. Depending on the frequency, volume, and duration of exposure, hearing protection may be required. Inadequate hearing protection or prolonged exposure to noise can result in either temporary or permanent hearing loss. Machinery and equipment are the most likely sources of hazardous noise in the workplace.
The hazard posed by health risk hazard. Exposure to excessive noise from unwanted plants and equipment can cause temporary or permanent deafness. Temporary deafness is often experienced after leaving a noisy place. Although hearing recovers within a few hours, temporary deafness should not be ignored as it is a sign that continued or regular exposure to such noise could cause permanent damage. Hearing loss is usually gradual due to prolonged exposure to noise. It may only be when damage caused by noise over a year combined with normal hearing loss due to aging. Exposure to noise may also cause tinnitus, which is the sensation of noise in the ears such as ringing or buzzing.
Auditory effect. First is hearing impairment. Exposure to high level of noise can cause permanent hearing loss. Neither surgery or a hearing aid can help with this type of loss. Short-term exposure to loud noise can also cause temporary change in hearing. First, it will limit our ability to hear high-frequency sounds and understand speech. Hearing aids may help, but it will not restore our hearing to normal. For example, we can hear hearing in our ears or our ear-filled stuff. Next is non-auditory effect. Non-auditory effect can cause communication problems at work and with family and friends, insomnia, stress, sleep disturbance, weakened immune system, increased blood pressure, fatigue, irritability and impatience, and lastly, anxiety and nervousness.
First aid in case by health risk. In case of emergency, we should seek to a professional or a doctor near our place to work. The first step is getting a hearing test and a true evolution from hearing care pros. There is a hearing aid, and hearing aids work by amplifying sound through three-part system. First is the microphone receives sounds and converts them into a digital signal. Second is the amplifier increase the strength of the digital sign. Third is the speaker produce the amplified sound in the ear.
Mode to protect employers' health risk hazard. The way to control workers expose the safe noise and prevent hearing loss include using countermeasures, isolating the noise sources, limiting worker exposure, or using as effective protective equipment. Such measures include modification of the machinery, workplace operation, and the layout of the workroom. In fact, the best approach for noise hazard control in the work environment is to eliminate or reduce the hazard at its sources of generation, either by direct action on the sources or by its confinements.
Conclusion: occupational noise exposure and hearing impairment have adverse effects on work safety and can increase the probability of work-related injuries. This means reducing noise exposure can contribute to increased safety in workplace where noise is a factor. Furthermore, using assistive listening device may reduce risk of work injuries among hearing impaired workers.